Love is something that I just have in my life. I've been a loving person, and with the love that I was able to have, I am so grateful that I can send this love throughout the world.
So one of the things that's kept you going through these last 2 years since you were diagnosed has been your family and your attitude that you know how to really live.
It's the most beautiful thing to have family. No matter how far we are from one another, we should be able to maintain that love, unconditional love for one another as family.
We're just trying to get through it the best that we can, and we just take it day by day, and we just support each other, and we give each other the love and that strong positive energy.
Every day I take life minute by minute, and I do the best that I can so that if the end of life comes, I would want to be told, Carmen, job well done.
Each and every one of us, from my role to every individual in the organization, needs to understand that if it were my mom, this is what I would want her to have.
What are you doing? You wanna get it? You wanna get it? Get it, Charlie. Can you kick? Can you kick it? You doing good?
What you thinking about?
Are you doing a big stretch?
What you thinking about?
Are you doing a big stretch?
Thinking about. That was a good one. That was a good spin.
You a big stretch? Yeah.
I think the hardest part for me was you have this expectation of how things are gonna be, and you mourn the expectations that you had when you have a baby who's different.
I'm the social worker assigned to work with Charlie and her mom and dad, and my job was to help with their goal, and their goal was to bring her home.
There you go. Where are you going?
We help, anticipate medication needs, equipment needs, support needs, bereavement needs.
Making sure the right insurance is in place, the right state programs, counseling, family counseling.
It doesn't matter what's going on in the future. We don't know what the future is going to be like. We just kind of have to keep going and keep doing everything we can for her now.
Sometimes our patients graduate and then they come back on service. That's okay. That doesn't mean that they're always going to be on hospice. It means that they've hit a bumpy patch and that they need extra support right now. They're a little more fragile.
I think the most important thing to remember is to live in the moment, because you never know where you're going to be months from now.
I'm 91-year-old World War II vet. I get a lot of assistance, thankfully, from Elizabeth Hospice. They're very generous, caring people. I don't know what I would do without them. And I'm so happy to be alive. And so many of my old friends were gone before me.
And the breathing is okay?
Breathing is good. Everything is good. Appetite is good.
It's amazing.
Yeah.
Really, a year and a half ago, they gave you 2 hours to 2 months to live.
Yeah. My son Robert asked the doctor, what's the prognosis? What can we expect with my dad? The doctor says, well, I really don't know. He may live for 2 days. he might live for 2 months.
It's so great to see how amazing your family has been to help support you, to surround you.
That's what I have left in life. What I live for is my children, grandchildren, and great-grandchildren. I'm very comfortable in my house.
And here you are, the cat with 9 lives. And thanks to Elizabeth Hospice, everything's going great. You're in the comfort of your own home. I'm just thrilled.
I wanted to stay right here where I'm most comfortable.
You know, I think the family was amazing. They have really stepped in, and I think the collaboration with the family, the caregivers that are here, and us coming in, we were able to stay ahead of some of these issues and symptoms.
I guess with all the wonderful loving care that I received after that, here I am, still kicking around, long after the expiration date.
My past experiences has really helped me dealing with difficult cases and families, helping them and realizing that I can be a part of a team where all of our gifts are drawn in. And it always brings me back to that hospice philosophy, which is that everything we do is to help alleviate symptoms, whether they be physical symptoms, psychological symptoms, social symptoms, or spiritual pain. And in doing that, we always have to remember that we never do anything that's going to hasten death, but at the same time, we do nothing to prolong the dying process. And sometimes it can be a fine line, but we're experts in this, and we feel very comfortable walking that thin line and making sure that everything we do is going to help the patient without hurting the patient unnecessarily. And the patients and the families really appreciate it, and it's a blessing being a part of it.